On behalf of the Speed Medical Institute and all the faculty members of Speed Medical Institute, we bring in all the greetings and wishes to Dr. Anjali for scoring Gynaec Oncology, MCH Gynaec Oncology rank of 8 and FET rank of 1 in the session of NEET SS 2021.
Thank you, sir. Thank you so much.
Best wishes to you. And it's great to have you in the session today and to discuss a few aspects of preparation of Gynaec Oncology. And now, can we know a little background before you start from where you come from and where you graduated and where you did your master's?
Yes, sir. Yes, sir. I am from Patna. I did my MBBS from Bangalore Medical College, 2011 to 17 batch, and I did my post-graduation primary DNB from BSA Hospital, Rohini, New Delhi. Currently, I am working as a senior resident in BSA Hospital, New Delhi.
Great, excellent. Doctor, after doing your master's and in OBG, the interest to Gynaec Oncology, when it started, how it evolved, and you decided even before that or during your post-graduation or after that?
Sir, I have never been exposed to Gynaec Onco cases during my residency days. Like I used to read only Onco cases and all, like management in the books only. I have never been exposed to all those.
And to do a super specialty, the idea of doing a super specialty?
Sir, I want to pursue higher education from beginning itself. When I have joined DNB, I would like to go for higher education.
Okay, very good. Now, to go on to that, what all you did from that point of time to give an exam on super specialty?
Sir, I have completed my DNB in September 2021. After that, I went home and I have taken this speed coaching crash course for 3 months. And I've started, the time was very short, so I was not having time to go through the big books like standard books, Berek and Hacker for Gynaec Onco and Garner's and Kamini Rao for IVF. So I have seen only speed videos. I used to sit in front of the mobile from the morning itself. I used to set some small targets like I have to revise this many videos, I have to see these many videos, and that I used to complete in that particular day. And I have solved all the MCQs, even small like subject wise also, and then all grant tests I have given, and I have seen the recorded videos like twice. And I used to revise the questions which I have made wrong, so that I have revised more.
So you were able to manage with the videos. Reproductive. What did you do for reproductive medicine? Because this exam had.
Reproductive medicine. Sir, for reproductive medicine, I have seen only speed videos, and it was very nice and it was very helpful. I was not having I have never been exposed to IVF cases, not even, we don't have infertility clinics in our hospital. So from seeing videos only, I have got all the knowledge which is required for the exam.
Okay.
And so it was very nice videos.
So my question was, to pass your final year exams in Obs Gynae, you would have put up a certain amount of knowledge required to clear it. Yes, that is one aspect. There is a required amount of knowledge that is required to clear a national level super specialty exam in MCH Gynaec Oncology. Now, from this final year knowledge of clearing the PG level exit exam to what the knowledge that is required to clear an MCH, how much of input to be given and required? Whatever we had, say suppose it is 30% what we had or 40% we had in final year, and we need to fill up another 30-40% to reach this, or how much you feel that this is a gap to be bridged?
Sir, actually, while preparing for practical and theory, DNP practical and theory, I was very much sure about 40%, because I have read some standard book like Williams I have read, and I have read areas. So I was pretty sure about 40% part. And for 60% part, I have taken a gap of 3 months. 3 months I was completely sitting in home and studying and seeing all the videos of speed and making MCQs, and that was sufficient for me to crack this exam.
Yeah. So almost 60% of gap you say that to be filled for this exam of, that's what I'm asking.
Yes, sir. Yes, sir.
So, I mean, you are today a standing example that you start 3 months before, go all out, do only that, and finish it off. Can I say that way?
Yes, sir.
No, no. I just want to take things from you. See, everybody has a style to do. Every student has a style to do. Everyone, and this is your style. That I finished in September, October, November, December.
Yes, sir.
3 months to go, and this 3 months, I need to have something to do to reach the target, and this is the way I did. So, and this is an example for people who say, I mean, you don't have 1 year to read or 6 months to read. If you decide at the point of time 3 months only the exam, still, I mean, you can do it because you're.
Yes, sir. Yes, sir. Yes, sir.
So, in this 3 months, I mean, full day is a whole day you prepare for this. Is complete preparation.
Yes, sir.
So yes, sir. From morning to night, I used to see the videos, MCQs. I was like fully into the speed app only.
Was it not tiresome, doctor? I mean, looking onto the screen for the whole day and doing it, I mean, is it not boredom and tiresome? Where is the motivation coming from? One day you can see, 2 days you can see, but continuous for 3 months.
Yeah. Sir, I was like, I was getting bored in between, but I thought like this is my first and last chance. After this, I am like, I cannot sit and read like for years and years for giving this like exam. So this was my first and last.
Do once, but do completely, full, all go.
Yes, sir.
Yeah,
Yes, sir.
properly.
Yes.
Very nice and very practical you are. I mean, very practical. Your approach is very good. Great, Doctor.
Yes, sir.
I mean, the message to be given by you. What is your message? And I'll tell you, you are really inspiring today, and your message will be required. It will be required for most of the students, and you have done a great job in 3 months. And because there are certain
Yes, sir.
mindsets, there are for people that I need to prepare for 1 year only, then I'll get. Like that mindsets are there. That's the reason why I'm telling you this. And what is your message
Yes,
for the
sir.
aspirants for MCH Gynaec Oncology?
Sir, I will tell like the first you should start from basics, and then once you are clear with your basics, then you should set daily targets. Like this much I have to complete. Like no matter how much time does it take. So like you should have some targets, daily targets. It's not like that you big targets. Like I used to do that only. I used to put some small targets like this many videos I have to complete, this many MCQs I have to complete, and I think so. Like for 60% for super specialty and even basics also, the speed app is sufficient. You have to see videos and you have to solve all MCQs. Even subjects wise also MCQs is very important. Try to remember the things which you mark wrong, and you should be more focused on the important topics. Like every subject has some important topics which will keep on repeating in exams, like PCOS, endometriosis for us, and then IVF protocols, that you have to thorough with this, and you should go through this thing, the guidelines you should be updated, and some important topics like of spiroff, important like IVF, like infertility part, and it's like all from all the books, some important things like you should see before going to exam. Like once at least you should make notes so that you can revise in the last. Otherwise, everything is there in the speed app. Even I have seen ESHRE guideline also, PCOS guideline also. I don't have to search it outside.
Great, doctor. It's wonderful message, and people will get to know from this. And I also request you to thank
Yes, sir.
whom all have helped your career so far, whom all you want to wish to thank.
So one more thing I want to tell. In the last, 10 or 15 days before exam, you have uploaded one video in which you were told like how to, what to do in the last 10 to 15 days. That was very inspiring for me. I have followed that only, that you have to revise this many times. You have to revise how much question you have to mark. I have followed that only. So my mindset was the sir has told that you have to revise 5 or 6 times. I used to keep on telling my husband, the sir has told me to revise 5 and 6 times. I have to revise 5 and 6 times. But I could like revise only 3 to 4 times, and I have attempted maximum questions. In And I have left only those questions in, I was totally blank. Like I don't have any idea about the options. That questions I have only left. And that was very nice video. Like it was very nice.
Thank you, doctor. And because generally when I say something in a video, I want to put a video across to inform people. I have really wondered
Yes, sir.
how many of them will really listen to it. I mean, I have really wondered. So today, but when I could hear that you have heard through that and you have followed few things, and
Yes,
I
sir.
feel very honored for your gesture, and definitely it give results, because I tell this because I have listened to more toppers like you. I've sat and I have listened and what all they have said, and I am just giving the summary what they have done. It is not my own invention. I have, through my experience, what I have heard from you today, you have said a lot of points you have said. I will take it with me, and I also grab everything and put it into a summary and tell students who are going. So
It was very helpful for the like beginners. Like, matlab, we have never been seen those cases. Like for us, it was very helpful. Matlab, the speed videos also, and your last moment videos was very nice, very nice.
I mean, that video was made. Come on, get up, go and give the exam and get the
Yes, sir.
results.
Yes, sir. Yes, sir. Yes, sir. That was very inspiring.
To say, because people will be there, but they want just one go, one push, and and definitely they go ahead and deliver things, and because they would have worked such a long time, and the last minute they will feel little slow. And I have done so much, I'm tired, and say, hey, don't go, come on, don't be tired, come on, go ahead and
Yes,
go
sir.
on fire.
It was like that only.
Finish off. You have done so far. Just one day, finish and then relax.
Yes.
Anyway, nice interacting with you, Doctor. Great, wonderful, and I wish you all the very best and all the success for a great career in Gynaec Oncology. And
Thank you, sir.
with your attitude and the personality and the kind of focus, and you will definitely do wonders. And there is no doubt.
Thank
And you can bring anything that you think just like that in a very short span of time. And I have seen that through the interview today, that you are capable of
Yes, sir.
doing it. And to implement quick things and a
Thank
quick
you, sir.
learner, and two things, quick learner and quick implementing, and to get results. That's very important, and it's great that we could observe from you. And the
Thank you,
specialty
sir.
will be benefited, and all the people going to get served through your services or getting served through your services is going to be enormous and great. Advanced wishes. Congratulations.
Yes, sir.
God bless you. Best wishes to you,
Yes, sir.
to
Thank
all
you,
people
sir.
around you. God bless.